Are DSOs trying to destroy dentistry or create opportunities for dentists to do better? It's Paul, Dr. Nacho Goodman. I am so excited to be interviewing our DSO panel in preparation for our Level Up event. Level up your career, your clinical, your case acceptance game with Dental Nachos, Dentist Job Connect, and Ripe Global. To watch in on this amazing event for free, favorite price of dentist, just text STREAM to 215-798-9897. I'm going to be interviewing people today that work in the DSO space so we all can learn more, share more, build a better dentisting world together. Will we have spicy conversation? Yes. Will we learn a little bit more about the reality of the dental landscape right now? Also, yes. So I'm ready for my friend Ryan Cunningham to start his video when he is ready, and we're going to chat with him. So Ryan and I go way back to early Nacho days. We are Northeasters. We live here in New Jersey and PA. So Ryan, welcome to our show, and just kind of orient our audience. You know, we all have 50 Zoom calls a day, 25 patients a day. You spin around like a top. What am I doing next? And I like to just say, let's orient our audience to who we're talking to. So tell us about yourself and what you do in the DSO space in your daily dental life.
Absolutely. So I'm Ryan Cunningham. I'm with Guardian Dentistry Partners. I oversee operations in the Northeast, so Pennsylvania, New Jersey, New York. And I work with our partners and our operations teams to continue to grow their practices, to provide them with staffing and support and to help them continue to develop the practices of their dreams.
Awesome. I like that. And I was at the Women in DSO conference, and I have Dental Nachos, and there's awesome people there, over 48,000. And someone sent me a message, a 50-year-old female dentist, and said, "Hey, Paul, I see you're at the Women in DSO. I'm very embarrassed to ask this question. I just Googled it. I Googled, what's the DSO?" So to you, Ryan, if someone was just saying, hey, I want to learn from someone who works in the DSO space, tell us what a DSO is. What's the Ryan Cunningham definition?
Yeah, I think, we do consider ourselves a dental partnership network. So, I know we like to change names, but that's what we call ourselves. And our goal is to find doctors to partner with that have practices and allow them to kind of select the things that they don't want to do anymore. Maybe they're tired of ordering more toner for their printers, things like that, tired of running payroll. Take those items off their hand, allow them to continue to do the parts in their practice that they truly enjoy, and, talk to them and develop a plan for future growth. So we take a lot of the back office off of the doctor. We keep the doctor as involved as they want to be in their practice. I have partners that want to really still do every interview and do all that work. I have partners that want to walk in at 8 a.m. and pick up a handpiece and work until 5. And when they're done, they're done. And that's their focus. And it's been a big part of our model is kind of bringing the services that they need.
I like that. Control freak dentist. Nah, not dentist, right? Not the blue pen, but get me a black pen or I'm quitting. So I totally see you work with us. You guys are you said 168 locations currently, right? So
Correct.
What that means, audience, is that means there's 168 dentists that said, I want to partner with a group, right? And underneath this group is the dental service organization, the DPO. You know what I say? The DSO DPO thing, it's like the dentist to say, I'm fee for service except for Delta. Well, that doesn't sound like fee for service. I'm out of network except for this. So I understand these acronyms can be confusing, but the concept behind it is key. What do you see, whether it's your DSO or DPO or others, what do you see they do right? Or when it goes right, what should it feel like? Because I'm going to ask you when it goes wrong, what it feels like. So at least start to paint the picture of what it feels like when it goes right.
Yeah, I think when it goes right, a huge part of it is setting expectations with the doctor as to, what services they want us to bring. They are open in their communication with us, if they want to continue to grow, if they're looking to cut back in a short time period, so that we can build a plan that allows them to do that. We allow them to, go out and hire a new associate, to add hygienist if they're looking for it, or start to build out a plan where, maybe they cut back on a certain day of the week. So that's the ideal, when they are open and they are willing to talk to us about what they want out of this relationship. And happens the majority of the time.
And I want to share, I'm a big fan of eating food, and Elvez is one of my favorite restaurants. Steven Starr is a restaurant group. So I just want to share, if you had a restaurant and you said to Steven Starr, I need a chef to come help me, he may have hundreds you could choose from. And if you're working by yourself, running your own restaurant, and you want an associate chef, it doesn't mean it's impossible. It's just different when you are not attached to a group that can help. So when it goes right, you have services that you can rely on. You have people that can help you. They remove hassles off of your plate. You get to maybe take more time off. What happens when it goes wrong, or when DSOs go wrong? Whether it's misaligned expectations, wrong choice by the doctor, challenges by the DSO. Tell us what happens when things go wrong.
I think, the first thing is that the doctor has to be ready to work with a partner. In this case, the partner's obviously guardian, but that partner could be, another doctor that they work with. I think understanding that the partnership is a relationship, just like every other relationship in your life. So when there's a lack of expectation setting from both sides, and then that partnership has to continue to work, and it definitely creates challenges. And I think that's where, you hear a lot of the bad stories in the industry, is because we need to understand that we're coming into work together. While we believe in clinical autonomy, and that's something that we would never get near, when doctors want to partner with anyone but still run their practice every moment exactly how it was before, and they still want to kind of do whatever they want all the time, or maybe they don't set the expectations in the proper way, that they say, hey, I want to be here 5 days a week for the next 5 years. And then 1 year into the relationship, they're talking about, actually, I'm going to cut back 2 days. It's the partnership has to be about transparency and about setting expectations so that we can all succeed together.
I really like that. And I think, you're really bringing awareness of the reality of what's happening. I went to this place last week. It was called CVS, right? And the pharmacist didn't own the place. And they gave me my medication, and it is a DSO of pharmacies. And while it's not an exact parallel example, it's that we've seen this in medicine, we've seen this in pharmacy, we're seeing this in vets, right? And we're seeing this in dentistry. And what my goal, Ryan, is to bring awareness of the reality without judgment to this space. We have DSOs that own 168 offices like yours, 1,000 offices, 10 offices, and we're really learning here. So I have a few fun questions. Ryan, if you were going to get a pet, would you name it EBITDA, Recap is Coming, or Total World Domination? Those are your only 3 choices.
I guess if those are my only 3 choices, probably EBITDA.
EBITDA.
It's something of the 3, it's probably the best, and it allows us, to continue to bring awareness as to what that means.
So this is what I want to do. So there's a book called Built to Sell. I don't know if you ever heard of it, Jim Collins. I mean, this is for any business, right? Every dental office needs to think about selling it one day, whether it's to a private practice dentist, whether it's to a DSO, whether it's to their child, like my dad sold to me, right? Built to Sell is, I think, a really good book. It might be also a podcast. What should dentists be thinking about? Let's say a dentist is saying, I want to have different opportunities when I go to sell my practice. I'm a solo GP in Philadelphia. I got 6 operatories. I do $1.4 million a year. I've been a solo GP for 30 years. And I'm thinking about over the next 5 to 8 years, wanting to get ready to sell my practice. They just said, hey, Ryan, you're someone who works with 168 offices. What are some things they should be thinking about and doing to get ready to sell?
I think, the first is, I would always encourage them to have conversations earlier rather than later. Don't have the conversation, start talking about selling when you want to maybe cut back in a month. Have the conversation a few years out, start to talk to people in the industry, and get an idea of what your options are going to be, because the longer you wait, you do start to have fewer options. And I would also say to keep doing what you're doing. You've most likely built a great practice. You've built a great team. You want to focus on continuing to do all the things that have made you successful, and look for opportunities to continue to grow, rather than plateauing or falling off, in your.
I think keeping your foot on the gas pedal, especially when it comes to marketing new patients, is key. And I also want to share that a dentist looking to sell needs to be open-minded, because I sell practices, and we put a practice in front of 6 private practice dentists once. and none of them wanted it. And they wound up selling to a DPO because they didn't want to be a dentist for the rest of their lives. So you may be sitting there thinking, I would never sell to a DSO, or I would only sell to a DSO, or I would only sell to private practice. And to me, Ryan, that's a very limiting thought process, because you don't know until you're in it what really is going to make the most sense for you. The thing I want to ask next is, just to manage expectations and just to start to understand some of the ABCs of this world. Most of the time when Guardian Dental Partners buys a practice, how long is that original owner staying to work in some capacity?
We really like 5 years. I think that allows us to grow in the partnership together. It allows us to really lay out a transition plan with the existing doctor to go out and recruit the right dentist to eventually replace them, and to really integrate that doctor into the practice. We do less. I have partners, frankly, that have been with me for 7 years and plan on staying on a lot longer. And that's always great. But
Yeah.
I think five years is definitely a big goal.
So even if I was like, hey, Ryan, I'm Paul, I got a dental practice. It's a good practice. We have solid EBITDA. I want to sell, but I want to be done in 6 months. You most of the time are going to say no, thank you to that opportunity for a dentist most of the time.
I think, listen, if you have an associate maybe who's doing a lot of work in your office, that obviously makes the transition easier if they're going to stay around. But 6 months definitely would be a challenging timeline in a solo practitioner setting.
Cool. Next kind of line of questioning I'd like to know is, owning a dental practice has now become very creative, right? My dad was a dentist with his partner. They were literally 50-50 partners until I came into the practice. Just a classic 50-50 partners. There's many dentists watching that own their practice 100% of the time. Tell us about some of these pathways to partnership that Guardian has, whether it's for an associate, whether it's post-sale. We don't have 82 minutes to discuss it, but just kind of give us a summary of some of these creative partnership opportunities that do now exist in 2023.
I think, we truly look for partners in all of our offices. It's a goal of ours, to continue to have partners, whether that's a doctor who is joining us with an existing practice, and, we form a partnership with them so that over, the term that they're going to stay with us, they could experience the upside of the growth of the office. And then, we also look, as we bring in associates that have a desire to become an owner, we have a pathway to partnership that allows them to, become an owner of a practice, ideally without at times having to go out and get a big loan from a bank, and allows them to experience a lot of the benefits of ownership.
Awesome. I think, and I think the dental world's changing, for so many different reasons. I think one of the things that people don't talk enough about, Ryan, and I see, is that people are very mobile in what they want to do with their jobs. They have a spouse that has a job, they move across the country, and owning a dental practice 100% is literally like a business anchor. And to some people, that business anchor is awesome. And to other people, it's incredibly limiting. I think that dental practices and dental dentists have great opportunities, but when you own a business that's related to people coming into that business in person, and you purchase in Conshohocken, PA, you're now saying, I'm likely going to be in Conshohocken, PA, and it's not easy to make a transition. So when you have creative ownership strategies, it may present flexible career opportunities for people as well. We're going to wrap up in a couple minutes, Ryan, but I wanted to ask this question. What's a myth about a DSO? So there's a lot of fear factor out there. Some people say on Dental Nachos, I hate DSOs. I go, have you met a DSO? Never met one. Never met one. Don't know what they is. I just know I hate them. It's like Yankees fans and Mets fans, right? So you alluded to the clinical autonomy, and I know you can only talk about your DSO because yours, and I can only talk about my practice exactly. But what's maybe a myth? Is it dentists don't have to do more crowns if they didn't do more crowns, or dentists don't have to diagnose perio disease on 90% of people? But what would you like to do? You have an opportunity on this platform to dispel a myth about DSOs. Here's your chance. What would you dispel?
So I think one that I've heard a lot that, have to overcome is, that they're going to come in and change my staff, and I can't understand why any DSO would ever want to do that. When we partner with a doctor and we look at their practice and what they've built, we're looking at the staff that they have now. As we come to our relationship, we're basing it off of their current staff. Replacing staff is a huge challenge. I have no interest in doing that. If your front desk is doing a great job, awesome. We want to keep them there. Your hygienist, we hope we can give them opportunity if they want to work more, if they, want better benefits. We hope we could bring more to the table so that they are even happier after our partnership. But again, I hear it sometimes about, well, they're going to get rid of my staff and they're going to tell me what to do. And the staff side is just,
and we're going to talk with a talent recruiter in a second. One of the things I say that just makes me laugh about this, whether I was buying a practice, just my third practice, or whether I was part of a DSO, team is so difficult to come by. At least use the people that work there first, because where is this whole group of people? I mean, dental assistants, very challenging to come by. Dental hygienists, I think a real crisis in our profession, whether it's 168 Guardian or a startup dentist from our sponsor ideal practices, finding dental assistants and dental hygienists, especially dental assistants, is a huge vulnerability, because the specialization of care, like we have a surgical prosthodontist, Ryan, is like a superhero of dentistry. But if his assistant can't make it that day, it just collapses everything. So I think your point is well taken, because why would you want to change a team without at least seeing how this team runs? And, just to kind of deepen this, they're working with the dentist that you just bought. So why would you make the dentist that you just bought frustrated by having a whole new team? So I did, well, Ryan, you're going to be part of our awesome Level Up panel. We've been friends for a long time when you're just growing your organization and mine. I still like to talk about the time that I've mentioned 100 times. I found you an associate in 24 hours. So check out Dentist Job Connect. I did help Ryan with a crisis. I had Drew. She was born in 2018. Ryan said, put her down. I need an associate. So but how can people reach out to you? Remind our audience, they are watching this, listening, and they want to reach out to Ryan Cunningham, Guardian Dental Partners. What would be the best way to do so?
Yeah, definitely through our website, guardiandentistry.com. My email is ryan.cunningham@guardiandentistry.com. But if you just go to the website, you can definitely get in contact with myself or some other great people.
Awesome. We'll stick around for a few minutes for our next interview. Thanks so much for sharing with us.
Thank you.
Awesome. So as you guys can see, we're talking about what's the deal with DSOs. Are DSOs trying to destroy dentistry or create opportunities for dentists? Let's dial down the drama